Hey, so I'm going to be talking about injuries are not accidents, Chapter 17. The big thing I want you to know is there are two different categories of injury death. There's an unintentional and intentional. Unintentional is just like it sounds. People didn't do it. Um, and when I say accidents too, injuries are not accidents. When you see this unintentional, a lot of times people trip, do something they didn't intentionally do, and then they injure themselves. Obviously, intentional injuries are definitely not accidents, homicide and suicide. But here's the thing I would like to put out there is that public health people will tell you that anything that can be preventable is not an accident. And so for injuries, we look at them as being preventable. Many of them can be preventable. So when we talk about the epidemiology of injuries, it's the fourth leading cause of death in the United States. It's a leading cause of death for people 1 to 44. So people are more likely to injure themselves and fatally do it so than anything else, even diseases. Higher injury rates in groups of lower socioeconomic status. Many injuries are not fatal, but fatal injuries are the ones that are most reliably reported. So when it comes to people injuring themselves and fatally doing it, it gets reported often by the hospitals. And this is not always the case with diseases. Sometimes diseases are not classified as well. Injuries that result in long-term disability, especially head and spinal injuries, are very costly. And if we could prevent them, obviously the pain that goes with it, the secondary diseases, are really worth it. Males have higher injury rates than females, and Blacks have lower injury mortality rates than whites, with the exception of higher homicide rates. So when you look at this, these are the leading causes of injury: poisoning, motor vehicle injuries, firearm injuries, falls, suffocation, drowning, fire burns, and then cutting and piercing. So what I want to do now is I want to bring us out to, and I don't see this in the PowerPoint itself, I'm going out to the CDC injury chart. So CDC keeps an injury chart, and CDC is in charge of keeping all the injury data. And how it works is that we have something called ICD 10 codes. These are the codes that people use to bill back for the insurance, but also they're codes that when people are admitted into the hospital, they get categorized. These codes then go to CDC, and then this is how they can pull up their charts. So let's do the 10 leading causes of injury deaths by age, okay? So I'm pulling this up. So for children under 1, it's unintentional suffocation. So SIDS would probably fall under that. Homicide unspecified, the shaking baby, unintentional motor vehicle traffic-related crashes, unintentional drowning, and then you could see as you go down how they're ranked. But if we go across this direction, these are the number 1 by age group. So under 1 is unintentional suffocation. Then 1 to 4, it's drowning. And then 5 to 9, we start moving into traffic crashes. So a child from 5 to 24 is more likely to be killed in a car crash than anything else. Then we move to unintentional poisoning. And what does this mean? This means that people unintentionally poison themselves, like for example with alcohol, and maybe they take a Valium, and then they never wake up because their central nervous system shuts down because both of those are depressants. And then you can see with 65 plus, it's false. But the number 1 cause of death across all the age groups is unintentional poisoning. Fascinating, isn't it? So you could see how we count people to really figure out what the problems are. And you say, why would public health like to do this? Well, obviously, that if we have children more likely to die in a car crash, then what do? We seatbelts. We promote booster seats for seatbelts. We promote children being in seatbelts. We promote 15 to 24s, really being aware that that is the time when crashes occur. And so we let people know about these things so that they can do something about it. Okay? And we go into injury prevention by looking at that. We look at deaths, we look at hospitalizations, we look at emergency department visits, there are codes for that. And then we also get episodes of injuries reported. So it's constant data collection to see how people are dying and what are the fatal injuries. So one of the big things is that we understand that injuries are really about human behavior. People not really thinking through about what's around them, but also it's about engineering, how our roads are designed, how our cars are designed. We look at public health, we look at injury control. We look at how it happens, what causes it. Very similar to infectious disease. So instead of analyzing a pathogen or a virus or bacteria, we look at the chain of causation. So the host would be maybe a car, the agent would be a human being, and the environment would be the road. We look at primary prevention. What do we look at before the event happens? So were people alert, where they could see the road? We look at things that happen during the event. So for example, someone not seeing the stop sign and then coming through the stop sign and then hitting a person. That's a T-bone crash. And then tertiary, we look at what happens after the crash. What's the emergency response time? Do people get to the crash in time? Are there hospitals prepared to handle the crash victims? That's tertiary. So that's actually keeping people from dying, okay? So by that time, we're kind of in the rehab, doing damage control. Think of tertiary prevention as damage control. There are 3 E's of injury prevention. Education, we've got to educate people first, right? Enforcement, so that's a big thing. When I was doing Office of Traffic Safety and working with the police department, I would go out with them on their DUIs and their car seat checkups, because enforcing people and getting people to change their behavior is one way to stop them. So people understand that they will lose their license if they drive drunk. And then engineering, how the road's designed, how the stop lights are designed, how the car seat is designed, how the seat belts are designed, how skateboards are designed, how bicycles are designed, how bicycle helmets are designed. Do you see how I start getting into all this design? So we really look at the end that how things are designed. And this insight really started to happen with the auto industry, because the auto industry has really brought down their fatalities. What is happening with cars continually reduces cars crash and motor vehicle fatalities. So the next big thing is poisoning. So the leading cause of injury death, as you know, and when we looked at the very top, was unintentional poisoning. So I'm going to bring up that inappropriate prescription of controlled substances. I mean, people who are just popping Valium, opiates, and then combining it with other drugs, or just doing too much, they can poison themselves by accident. So really working with the DEA, the Drug Enforcement Agency, to really track down overprescribing, illegal use, tracking how many opiates are being prescribed. If you look at the opiate and you look up the map for CDC, and you see how in one state, I believe, they had prescriptions, 4 prescriptions for every individual. So they were overprescribing opiates. So they're really changing that and saying, cut it down. And then suicide by poisoning is the most commonly involved psychoactive drugs. So what I mean by psychoactive drugs are anything that changes your brain chemistry. So anything when it comes to Valium, opiates, marijuana, barbiturates, alcohol, anything that changes the chemistry in the brain. And so the New York State General proposed an online drug tracking system that would actually reduce the risk of patients obtaining multiple prescriptions for opiate drugs. So that's one of the big things too, is that opiate drugs is a narcotic and people can really truly overdose on this and then combine it with other drugs, and then they have interactions and then they die. So poisoning is our big concern in the United States. We've got a problem there. The next big thing, so poisoning is number one, right? The next big thing is motor vehicle injuries. And I used the motor vehicle injuries all the way through the education, engineering, and then enforcement. But motor vehicles are number two. So number one is poisoning, number two is injury and from motor vehicle crashes. And so, so they really started to reduce this. And motor vehicle fatalities have decreased by over 40% since 1968. So huge gains in this. In engineering, this has made a big difference. So we move on with motor vehicles. This is a success story. The speed belts, the speed limits, the seat belts. Alcohol plays a major role in fatal crashes. We're really pulling that out, but we still have a problem with alcohol. The second leading factor is youth and inexperience. So having graduated driver's license where someone had to sit in the front seat with a new driver to really help them learn how to handle that big car or not driving at night. Those were two big things that happened with the graduated driver's license. They had to learn before they could get out on the road. Zero tolerance for blood alcohol. So this means no alcohol whatsoever for anyone who is underage in driving. So that starts to come out too. I mean, obviously they shouldn't be drinking and driving, period, but zero tolerance. And then distracted driving still continues to be one of the biggest causes of fatalities for youth. When you look at single vehicle crashes for youth, it's because they're distracted and then they go off the road and they crash into like a telephone post or something like that, and they're distracted. So I have to emphasize that if you're ever teaching someone to drive and they're young, especially, this is when they make mistakes and they get distracted, and then this is where the fatalities come in. Next big thing is pedestrians. 19% are over 65 years old, so older people getting hit. And then children under 14 have the highest risk, 21%. Another big one are motorcycle deaths, and requiring helmets was a big one. And then bicyclists tend to be about 750 deaths per year, and 7% are under the age of 15. So moving to helmets was a big thing. But I can tell you that one of the big things with bicycles, it's really taking bicycles away from the road and really making it so that the cars and the bicycles don't mix. This seems to be the safest way for bicycles, because often motor vehicles don't see bicycles, or bicycles are unaware that they're in the way with the cars, or they're just oblivious and they're acting like they own the road. So it goes both ways, okay? But they need to share the road, both the bicyclist and the motorcyclist. But environmental design is really key. Firearms is the next big thing. This is the third leading cause of all injury deaths in the United States. 60% of them are suicides. So the majority are suicides with firearms. The rest are with homicides, and then unintentional injuries. So, but you can see that homicides and suicides are the biggest things how we're using guns in the United States. Homicide rates are 2 to 5 times higher in the U.S. than any other developed country. We have high homicide rates. But the thing is that violence is traditionally thought of as a criminal justice issue rather than a public health issue. But I would tell you, as a public health person, I completely disagree with this. And CDC would love to do research on violence, but they lost all their funding in 1996 when they started to broach this topic, and they haven't hit it again. So you'll see that CDC does no research around violence and firearms, which I think is a problem. Gun control legislation has been opposed by NRA, and 38%, almost 40% of the U.S. holds at least one firearm. So out of every 10 people, 4 people have a firearm in their house. And then residents of a household with a gun are 3 times more likely to die in a homicide than a person who does not have a gun in their house. Let me repeat that again. Residents of a household with a gun are 3 times more likely to die in a homicide. So here's the thing about having a gun in the house. It really needs to be locked up, and it really needs to be treated as a weapon. And if you have anyone who's suicidal or homicidal in the house, all guns need to be removed. Unfortunately, they're used in domestic violence, and they're used in suicide. So that's a big problem with guns. The next big thing is occupational injuries. And so that's a big thing too. So we have over 4,600 deaths per year, and including the motor vehicle crashes when someone's working and doing things, or falling when they're caught in equipment, or logging and fishing are the most dangerous occupations. And that makes total sense, because when you watch logging and fishing, they are very intense and very stressful, and you've got a lot of things moving around. Domestic violence is the next big thing. Child abuse. Every year we have 70% younger than 3 years old dying from child abuse. Over 686,000 are treated in emergency rooms due to violence. And then physical or sexual victimization is a risk factor for future victimization and perpetration. The next thing is intimate partner violence. This includes rape, physical violence, and stalking. There are over 12 million people affected, and of course we know with this number, there are people who do not report because they're afraid of retaliation. So that's another one. The next one I'm going to mention is non-fatal traumatic brain injuries. And I put some information about concussions. One thing that people don't understand is there's signs for concussions, and sometimes people don't understand that TBIs are something that need to be watched. So one of the things that they're starting to do is really train teachers and coaches on how to look for the symptoms of a concussion and to watch them. So for example, I was a coach. I had a soccer player who hit her head getting out of a bus. Can you believe it or not, a school bus? And so one of the big things is really watching that person afterwards. But this happens often, is that people will injure their heads, and you need to watch them afterwards. One of the big things, as I talked about, was tertiary prevention. And so this is really looking at special trauma centers, use of helicopters. It's after the fact. It's trying to keep the person alive after they've been injured. Okay, so it's mortality prevention, morbidity prevention, long-term illness prevention, so they don't get secondary injuries or they don't die. That's called tertiary prevention. So I have a question for you, and I just want to see if this is extra credit. Think of an injury you or your family member has suffered and analyze the injury using host, agent, and environment. How did it happen? Can you see who the host is? So the host could be the car, the agent could be a person, and the environment could be the road. But it also could be falls, it could be skateboarding, it could be skiing, it could be biking. So break it down into each one of those and describe how it could have been prevented, or how a difference would have been made with the engineering, with enforcement, with education. The other one too is that I'm curious, you could also do this too, is that you could choose this as your extra credit one too. I'm not going to have you survey in your class, but I would like you to go around and really kind of look around. Do you use your seatbelt? When you look around, do you see people doing bicycle, motorcycle helmets? Do you see people adhering to speed limits? Do you have a detector in your home? Do you have a firearm in your home? Each one of these are indicators and predictors for injury. So how people use them and what they do to contain them or prevent things from happening is how they can keep injuries from happening. This one you don't have to do, but I would love for you to, I could see this being an essay question in the final exam. Using the ecological model, okay, see chapter 14. Look in your book for this. This is like the environment. So when you think of ecological, you're thinking about the environment. Design a program to prevent firearms injuries in your community. How could you prevent firearm injuries in your community? And I'll be super impressed, and this is definitely going to be something that you'll see on the final exam. Okay, take a look at these injury maps. These are kind of interesting. You can actually see highest suicide rates. You can create a map for your state, and you can really look at this in detail. So we're going to click out here. Oh, the link's not working. That makes me mad. So let's go back to here. I think it's because I got the what's that called? I got to escape out of this, and boom. I want to make sure this link works. We're going to go out to here and going to take that out. Still not moving. Okay, I'm going to put it out to another page. This is when there we go. So this is the mapping. So you can actually look at data and you can do visualizations. So let's do our causes of death. So we can, let's pull the United States. Let's just do all of the United States. Oh no, I don't want to do Northeast. Let's do West. That's always interesting. And so this, you can see here what our big rates are. Click on here. Wow, super interesting. So much injury data. We have so much, we can break things down like you wouldn't believe by how many people are dying from what, and you can see all the data here. Very fascinating. So from this, for your extra credit, you can either choose discussion question 1, 2, 3, 4. Personally, I think 4 is kind of fun, and answer that. You can also check out number 5, where you look at the NHTSA website, number 6, and number 7. You can answer any one of those, but I think the one that I think is really fun is this discussion question 4. But choose one of the discussion questions, and for extra credit, if you answer it, I'll give you some points. All right, that's it. Now, I want to take you out to this week. See, it's not a very super hard week. I wanted you to make sure that you knew the basics of injury prevention. And so when I look at this, one of the big things I wanted to make sure that you knew was that you knew the 3 E's, right? Education, engineering, and enforcement. Do you know the CDC's role in injury prevention? I talked about how they gather data. Do you know, can you identify the top injuries for each age group? That would be pretty cool if you could be able to do that. And then being able to really understand how the model is with the what we call the injury causation. So I'm going to add that one on there too, because injury causation model. So that's the whole host, agent, and environment. Being able to prevent things before they happen. So this week, what I want you to do is I want you to make sure that you do the chapter review. That if you want to, you can do an extra credit, and I'll post it in there, and you can build up your extra credit. And look, you have a quiz 3. It's going to cover tobacco, maternal, child, adolescent health, genetic testing, and then injury prevention. All 3 of these, actually 4. 1, 2, 3, 4 chapters. What you do is you will actually have 2 attempts on this. And what I've done is it's in your module. You'll see it's sitting right here for you to do. And I have it opening up. Let's see, it's going to open up on April 6th. I might open it up earlier. And it's going to Oh, it's already open. Okay. But it's going to be due April the 6th. Actually, I'm going to extend it a little bit too. So anyhow, this is what the different chapters are going to be on. And then the last thing I want to make sure that you see is that I've opened up also week 12 too. So if you want to work ahead, you can. Okay. I will also have office hours and things like that if you have any questions whatsoever. Okay, great. Have a great week, and keep working. And if you want to, work ahead. All right. Bye.